Hello everyone, my name is Jaspreet Kaur. I am Assistant Professor, School of Health Sciences in RIMT University. So today we will discuss about schizophrenia. So let's start with the topic. First of all, introduction. Schizophrenia is serious mental disorder in which people interrupt reality abnormally. Schizophrenia may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning and can be disabling. People with schizophrenia require lifelong treatment. People with schizophrenia often have problems doing well in society, at work, at school, and in relationships as well. They might feel frightened and withdrawn and could appear to have lost touch with reality. This lifelong disease cannot be cured but can be controlled with proper treatment. For this, antipsychotics are the most common drugs which we are used to treat schizophrenia. Now move to the causes. What are the causes of schizophrenia? The exact cause of schizophrenia is not known. It's still unknown, but like cancer and diabetes, schizophrenia is real illness with a biological basis. Researchers have uncovered a number of things that appear to make someone more likely to get schizophrenia, including first of all genetics, we can say heredity. Schizophrenia can run in families, which means a greater likelihood to have schizophrenia may be passed on from parents to their children. Next cause is brain chemistry and circuits. People with schizophrenia may not be able to regulate brain chemicals called neurotransmitters like dopamine, serotonin that control certain pathways or circuits of nerve cells that affect thinking and behavior of the individual. Next cause is brain abnormality. Research has found abnormal brain structure in people with schizophrenia. But this does not apply to all people with schizophrenia. It can affect people without the disease condition. Next is environment. Things like viral infections, exposure to toxins like marijuana, or highly stressful situations may trigger schizophrenia in people whose genes make them more likely to get the disorder. Schizophrenia more often surfaces when the body is having hormonal and physical changes like those that happening during the teen and young adult years. Now, who gets schizophrenia? Anyone can get schizophrenia. It affects people all over the world from all races as well as cultures. While it can happen at any age, schizophrenia typically first appears in the teenage years or early 20s. The disorder affects men and women equally. Although symptoms generally appear early in males, the earlier the symptoms start, the more severe the illness tends to be. Children over the age of 5 can have schizophrenia, but it's rare before adolescence. Now move to the signs and symptoms of schizophrenia. First of all, early symptoms of schizophrenia. The condition usually shows its first sign in men in their late teens or early 20s. It mostly affects women in their early 20s and 30s. The period when symptoms first start and before full psychosis is called prodromal period. It can last days, weeks, or even years. It can be hard to spot because there is usually no specific trigger. You might only notice subtle behavior changes, especially in teens. These include a change in grades, social withdrawal, trouble concentrating, temper flares, and difficulty sleeping. Next is the positive symptoms of schizophrenia. In this case, the word positive doesn't mean good. It refers to added thoughts or actions that are not based on reality. There are sometimes called psychotic symptoms and can include first of all delusions. This means false, mixed, or sometimes strange beliefs that are not based in reality, and the person refuses to give up even when shown the facts. For example, a person with delusions may believe that people can hear their thoughts or they are God or the devil, or that people are putting thoughts into their head and plotting against them. Next positive symptoms is hallucinations. These involve sensations that are not real. First of all, there are 5 types of hallucinations based on our 5 senses. First of all, auditory hallucination, visual hallucination, olfactory hallucination, tactile hallucination, and the last one is gustatory hallucination. In schizophrenic patients, the most common is auditory hallucinations and visual hallucinations. In auditory hallucination, hearing voices is the most common hallucination in people with schizophrenia. The voices may comment on the person's behavior, insult them, or give commands. Less common types include seeing things that are not there, smelling strange odors, and having a funny taste in your mouth, and feeling sensations on your skin even though nothing is touching to the body of the patient. Third positive symptoms include catatonia. In this condition, the person may stop speaking and their body may be fixed in a single position for a very long time. Next is disorganized symptoms of schizophrenia. Talking in sentences that do not make sense and using nonsense words, making new phrases, making it difficult for the person to communicate or hold a conversation. Next is shifting quickly from one thought to the next without obvious and logical connections between them. Moving slowly. Next is being unable to make decisions. They are not able to take their own decisions. Writing excessively but without meaning. They will write irrational words. Next is forgetting or losing things. Repeating movements or gestures like pacing and walking in circles or moving their shoulders. Having problems making sense of everyday sight, sound and feelings. Now the next is negative symptoms of schizophrenia. The word negative here doesn't mean bad, it notes the absence of normal behaviors in people with schizophrenia. So the negative symptoms of schizophrenia include lack of emotion or a limited range of emotions, withdrawal from family, friends and from society and from the social activities. They will feel less energy, they will speak very less, and the lack of motivation, lack of pressure, and there will be no interest in life. People with schizophrenia. They will not maintain their hygiene and grooming habits. Now how is schizophrenia diagnosed? How we can confirm the patient is having schizophrenia? If symptoms of schizophrenia are present, the doctor will perform a complete medical history, sometimes a physical exam. While there are no laboratory tests to specifically diagnose schizophrenia, the doctor may use various tests and possibly blood tests or brain imaging studies like MRI or CT scan to rule out another physical illness or any type of intoxications like substance induced psychosis as the cause of the symptoms, or is there any brain abnormality. We can find out the cause of the symptoms. If the doctor finds there is no other physical reason for the schizophrenia symptoms, they may refer the person to psychiatrist or a psychologist. Mental health professionals trained to diagnose and treat mental illnesses. Psychiatrists and psychologists use specially designed interviews and assessment tools to evaluate a person for a psychotic disorders. The therapist bases their diagnosis on the person's and family's report of symptoms and their observation of the person's attitude and behavior. A person is diagnosed with schizophrenia if they have at least 2 of these symptoms for at least 6 months: delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and the negative symptoms. One of the symptoms has to be delusions, hallucinations, and disorganized speech. During these 6 months, the person must have a month of active symptoms. It can be less with successful treatment. Symptoms should negatively affect them socially or at work and cannot be caused by any other condition. How is schizophrenia treated? The goal of schizophrenia treatment is to ease the symptoms and to cut the chances of relapse or return of symptoms. Treatment include, first of all, medications. The primary medication used to treat schizophrenia are called antipsychotics. These drugs do not cure schizophrenia, but it helps to relieve the most troubling symptoms like delusions, hallucinations, and thinking problems for schizophrenia. And the medications include, first of all, older. This is also known as typical antipsychotics or commonly referred to as first generation antipsychotic medications. And the examples include chlorpromazine, and the trade name is thorazine. Next is haloperidol, and trade name is Haldol. Now the second generation, this is also known as atypical antipsychotics or newer drugs used to treat schizophrenia include risperidone, aripiprazole or asenapine. Along with medication, patients also required coordinated specialty care. This is a team approach toward treating schizophrenia when the first symptoms appear. It combines medicines and therapy with social services, employment and educational interventions. The family is involved as much as possible. Early treatment is key to helping the patients lead a normal life and to recover from the psychotic disorders. Now the next therapy is psychosocial therapy. While medication may help relieve symptoms of schizophrenia, various psychosocial treatments can help with the behavioral, psychological, social and occupational problems that go with the illness. Through therapy, patients can learn to manage their symptoms, identify early warning signs of relapse and come up with a relapse prevention plan. Psychosocial therapies include, first of all, rehabilitation. While focuses on social skills and job training to help people with schizophrenia function in the community and live as independently as possible. Next is the cognitive remediation, which involves learning techniques to make up for problems with information processing. It often uses drills, coaching and computer-based exercise to strengthen mental skills among schizophrenic patients that involve attention, memory, planning and organization. Next therapy is individual psychotherapy, which can help the person better understand their illness and learn to cope up with their problems and also problem solving skills. Family therapy, which can help families deal with a loved one who has schizophrenia, enabling them to better help their loved one. Next is group therapy, or we can say support therapy or support groups, which can provide continuing mutual support. Hospitalization. Many people with schizophrenia may be treated as outpatients, but hospitalization may be best option for people with schizophrenia with severe symptoms who might harm themselves or others who cannot take care of themselves at home. And the last therapy is electroconvulsive therapy or ECT. In this procedure, electrodes are attached to the person's scalp. While they are asleep under general anesthesia, doctors send a small electric shock to the brain. A course of ECT therapy usually involves 2 to 3 treatments per week for several weeks, or it depends upon the severity of the disease condition. Each shock treatment causes a controlled seizure. A seizure series of treatments over time leads to improvement in the mood as well as thinking of the schizophrenic patients. Can schizophrenia be prevented? There is no known way to prevent schizophrenia, but early diagnosis and treatment can avoid or ease frequent relapses and hospitalizations and help cut the disruption of person's life, family and relationships. So this is all about the today's topic. So moves to the conclusion. Schizophrenia is most common disorder in psychiatric illnesses, and the specialists are psychologists and psychiatrists who treat the patient with antipsychotic medications. Thank you.